Many people in the United States, over 20 million, might have some kind of kidney problem, and often they don't even realize it. This can be serious and affect your heart, bones, immune system, and even your brain. In the worst cases, it can lead to needing dialysis or a transplant to survive. Did you know that some everyday habits, things you do without even thinking, can actually be hurting your kidneys? In this video, we'll talk about 10 of these daily habits and how to avoid them before it's too late. So let's get started. Number 1. Drinking too much alcohol can be harmful. Alcohol makes you pee more, which can lead to dehydration. It also makes your kidneys work harder to balance fluids in your body. Alcohol affects the liver, producing a substance called urea that the kidneys filter. If you drink too much, your liver makes more urea than your kidneys can handle, causing kidney damage. To limit alcohol intake, women should have no more than 1 drink a day, and men should have no more than 2 drinks a day. Drink alcohol slowly with food and also drink water or non-alcoholic beverages. Avoid drinking on an empty stomach or when you're thirsty or tired. Number 2. Smoking is a really bad habit, especially for your health and kidneys. It harms your blood vessels, which means less blood reaches your kidneys. This can make your kidneys not work well in filtering out waste and toxins. Smoking also increases the chance of getting kidney cancer, a common type of cancer. A study in the Journal of the American Society of Nephrology found that smokers have a 60% higher risk of kidney failure than non-smokers. So it's crucial to quit smoking as soon as you can. Quitting is not just good for your kidneys, but also for your lungs, heart, brain, skin, teeth, and your overall well-being. Number 3. Not exercising enough is not good for your health. Exercise helps you stay at a healthy weight, lowering the chances of obesity and diabetes, which are major causes of kidney disease. It also lowers blood pressure, protecting your kidneys from harm. A study in the Journal of the American Society of Nephrology found that people who regularly exercised had a much lower risk of developing kidney disease compared to those who didn't. Adults should aim for at least 150 minutes of moderate exercise or 75 minutes of intense exercise each week. It's also good to do muscle strengthening exercises at least twice a week. So make sure to get moving for a healthier life. Number 4. Eating processed foods is not good for your kidneys. Processed foods are changed from their natural form by adding things like salt, sugar, fat, preservatives, or artificial flavors and colors. Even though they are easy and tasty, they can harm your kidneys. Processed foods often have a lot of sodium and phosphorus, which can cause high blood pressure and kidney stones if you eat too much. High blood pressure can stress your kidneys, and kidney stones are painful mineral deposits in your urinary tract. A study in the American Journal of Kidney Diseases found that people who ate more processed foods had higher levels of phosphorus in their blood, which can damage kidneys over time. To avoid processed foods, try to eat more fresh fruits, vegetables, whole grains, lean proteins, and healthy fats. Cook your meals at home when you can, using herbs and spices instead of salt for flavor. Also, check nutrition labels on packaged foods and choose options with low sodium and low phosphorus. It's better for your kidneys and your overall health. Number 5. Drinking enough water is really important for your kidneys and your overall health. Water helps your kidneys get rid of toxins and waste from your body. If you don't drink enough water, these waste products can build up and cause issues like kidney stones and chronic kidney disease. Drinking plenty of water is one of the best ways to keep your kidneys healthy. The amount of water you need depends on things like your age, weight, how active you are, the climate you're in, and your health. As a general guide, it's good to drink at least 1.5 to 2 liters of water each day. However, you might need more or less based on your own needs. To stay hydrated, make sure to drink water throughout the day, especially before, during, and after exercise or when you feel thirsty. You can also have other liquids like herbal teas, juices, or soups. Just avoid drinks with caffeine, alcohol, or sugar because they can dehydrate you and harm your kidneys. Number 6. Eating a lot of meat is not so good for your kidneys. While protein is a good nutrient, too much animal protein can cause problems for your kidneys. Animal protein creates a lot of acid in the blood, which can harm the kidneys and lead to a condition called acidosis. This makes it hard for the kidneys to get rid of acid quickly, causing issues like kidney stones, bone loss, muscle wasting, and chronic kidney disease. So how much protein do you need? The recommended amount is 0.8 grams per kilogram of body weight per day for adults. For example, an average person weighing 70 kilograms or 154 pounds needs about 56 grams of protein daily. However, this amount may vary depending on your age, activity level, health, and preferences. To keep your protein intake balanced, try to eat more plant-based sources of protein, like beans, lentils, nuts, seeds, tofu, and quinoa. These foods are not only high in protein, but also low in acid, and they provide fiber and antioxidants, which are good for your overall health. Number 7. Not getting enough sleep is not good for your health, and it also affects your kidneys. Your kidneys have a natural 24-hour cycle called a circadian rhythm that regulates their work. When you sleep, your kidneys take it easy and rest. When you wake up, they get back to work, filtering more blood. This cycle helps your kidneys stay efficient and balanced. However, if you don't get enough sleep, your circadian rhythm gets messed up and your kidneys can't do their job properly. A study in the Journal of the American Society of Nephrology found that people who slept less than 5 hours per night had a 65% higher risk of developing kidney disease than those who slept 7 to 8 hours per night. Another study showed that people who slept more than 9 hours per night also had a higher risk of kidney disease. So both too little and too much sleep can be harmful. For adults, it's recommended to get 7 to 9 hours of sleep per night. To sleep better, try to stick to a regular sleep schedule. Avoid caffeine, alcohol, nicotine, and heavy meals before bed. Also, limit screen time and bright light exposure at night. Make your sleeping space comfortable and dark, and practice relaxation techniques like meditation, yoga, or breathing exercises. It's important for your overall well-being and kidney health. Number 8. Ignoring the urge to pee can be bad for your kidneys. If you ever hold your pee because you're busy or there's no bathroom around, it could put your kidneys at risk. When you delay going to the bathroom, urine stays longer in your bladder, allowing bacteria to grow and causing urinary tract infections, UTIs. UTIs can be painful, and if not treated, they might spread to your kidneys, causing serious damage. To prevent UTIs and take care of your kidneys, it's best to pay attention to your body. Go to the bathroom when you feel the need, and don't hold your pee for more than 4 hours. Make sure to completely empty your bladder every time you pee. It's a simple way to keep your kidneys safe. If you've enjoyed the information so far, remember to hit the like button, subscribe, and click the bell icon so you won't miss more videos like this. Number 9. Eating too much salt is not good for your kidneys. Salt is important for your body because it helps with fluid balance, nerve, and muscle function. However, if you eat too much salt, it can harm your kidneys. Salt contains sodium, which can increase your blood pressure and make your kidneys work harder to remove the extra fluid and sodium. High blood pressure can damage the tiny blood vessels in your kidneys, reducing their ability to filter your blood. This is a major cause of kidney damage and failure. So how much salt is too much? The American Heart Association suggests limiting your sodium intake to no more than 2,300 mg per day, which is about 1 teaspoon of salt. However, many people eat much more than that, especially from processed foods like canned soups, frozen meals, snacks, sauces, and condiments that are high in sodium. To cut down on salt, try to eat more fresh fruits and veggies, cook your own food using herbs and spices instead of salt, and carefully read nutrition labels when buying packaged foods. It's a simple way to take care of your kidneys and overall health. Number 10. Taking too many painkillers can seriously harm your kidneys. Many people use over-the-counter painkillers like ibuprofen and acetaminophen to relieve pain. However, these drugs can be especially bad for your kidneys, especially if you have kidney disease. Use them frequently or take high doses. The National Kidney Foundation warns that ibuprofen can reduce blood flow to the kidneys, leading to inflammation and scarring in the kidney tissue. Acetaminophen and aspirin, which are also painkillers, can damage your kidneys if taken too often or in large amounts. To protect your kidneys from painkillers, it's best to use them as little as possible and never exceed the recommended dose. If you have ongoing pain, it's a good idea to talk to your doctor about other ways to manage it, such as physical therapy, acupuncture, or meditation. These alternatives can help you deal with pain without risking harm to your kidneys. Your kidneys are important organs, and taking care of them is essential. By avoiding these 10 habits, you can make your kidneys healthier and slow down or prevent kidney disease from getting worse. Remember, it's better to prevent problems than to try to fix them later. Now we want to hear from you. Did you realize you had some of these habits that could harm your kidneys before watching the video? Share your experiences and thoughts with us in the comments below. We love hearing from you. Thanks for watching.